the right team can make or break your grade. Think back to when you were coming up. Remember being randomly assigned to a group project or presentation? Here were the players. That was that person that only wanted to get their point across. Then, those who really didn't want to participate and just wanted to put their name on the assignment, then those were precious. Because they really wanted to help, but definitely did not understand the assignment. Most of the times, I ended up doing most of the presentation myself and just letting them know how they could chime in. They did not valuably contribute any new idea. I continued to drive through projects throughout my education. That was until I went to medical school. There, I learned how working together could save lives. I also, unfortunately, learned how having poorly structured teams could lose lives. Now that I'm in a physician, I can tell you that the U.S. healthcare system is broken. The biggest problem with the U.S. healthcare system is that we don't know how to create well-functioning teams. Keeping individuals healthy is not an individual job, but a collaborative effort. We need people from all walks of life to serve in healthcare in order to fix it. The traditional U.S. healthcare system almost broke me due to its poorly functioning team structure. I worked in a community health center where 50% of my patients didn't have any insurance at all, just like the 30 million or so Americans out there now. Most of the times I knew what to do for a patient, but I couldn't, because they didn't have the support and resources that they needed. This reminds me of a patient, Mr. Jack. Yeah, that's a fake name. So, Mr. Jack was a towering, lovely, vibrant gentleman in his 50s. The kind of guy that when you were looking at your schedule for the day and you saw his name, a smile would pop up on your face because you were excited to chat with him. Well, Mr. Jack developed kidney problems. And although I worked in a place where I had a medical team and a medical home, with pharmacists, social workers, referrals coordinators, and the like, they actually didn't work well enough together to get the patients the care that they needed. So Mr. Jack developed kidney problems, and I was unable to refer him for early intervention to a nephrologist because he couldn't afford to go. Over time, his kidneys eventually failed, and I had to send him to the emergency room every 3 days because he couldn't afford to go to a dialysis center. The pharmacists worked really hard to supply his medications, but as they grew more unique and expensive, they couldn't supply it. The referrals coordinators tried to get him into a dialysis center, but he couldn't gain that financial assistance. For Mr. Jack, it became either go broke or die. Our team failed him. I felt like I was exhausting all of my resources despite having a care team by my side whose job it was to help patients find resources to get care. There had to be a better way, a better team structure in order to help healthcare providers provide the care that the patients needed. That search for a better way led me to telemedicine. Telemedicine had not been utilized widely in the past, although it had been around for decades. The 2020 pandemic changed all of that, opening up the virtual gates to access the care for everyone. What had almost seemed unimaginable to receive health care with your doctor via your iPhone or computer became almost the norm overnight. But that hasn't been enough. Telemedicine has broken barriers, opening access to care for many, but it's not living up to its fullest potential because subject matter experts are working in silos. We need better structured teams in the telehealth space in order to disrupt the status quo. Currently, we have doctors and nurses working on something, while the tech people are separately translating that into apps. There isn't enough cross-communication and collaboration. They're just practicing medicine the way they always practice, but just online. Doing things the way that you've always done will result in the result that you've always had. Results like inequity. African Americans are more likely to die from all causes at early ages, And no, it's not due to genetics. There are systems and policies in place that make it more difficult for minorities, people with disabilities, poor people, and people who love differently than the status quo to receive quality care. Telemedicine is supposed to change all of that, but it hasn't yet. Results like the inability to afford care. The U.S. is the only country in the developed world without any form of universal health care. We spend the most on healthcare worldwide, yet don't have the outcomes to show for it. We have almost 31 million people without any insurance at all, and another 30 million or so with technically insurance. But the deductibles are so high and the coverage is so low that they will fall into substantial financial debt if any health issues were to arise. Telemedicine was supposed to change all of that. But how? As I stated before, we need people from all walks of life to serve in healthcare. How can we create change if we keep using the same formula? I'm not saying that we need to think outside of the box. What I'm saying is there is no box. Let's take a look at Disney. Yes, this Disney. I've admired the company since I was a toddler for their films, but I've grown to love their business structure. Has anybody heard of the Imagineers? Disney has an entire team whose purpose is to dream bigger. Their real-life superpower is ideation and innovation, as they're responsible for the things outside of the film and television shows, things that are meant to be experienced, such as theme parks, resorts, cruise ships, to name a few. They have a no-box method of thinking. They have a manner of presenting ideas where they're told to leave their limiting beliefs at the door in order to present their grandest idea. They don't have to think about budget, tools, or even steps needed in order to provide their grandest and purest idea. From there, even if ideas aren't picked up, they're never thrown away, but can be taken for later use, sometimes coming back decades later. Now, if you were to think about the name Imagineers, you'd probably think they were a team of engineers. But no. Imagineers can come from almost any profession and contribute to the team. They can be architects, writers, concept illustrators, landscapers, to name a few. Almost 140 different professions contribute to the field in order to create a diversity of skill sets and expertise. As Einstein once said, logic can get you from A to B. Imagination will take you everywhere. Imagine this. What if there was a board of directors for a telehealth organization, but not just any old group of decision makers, something like the Imagineers, but healthcare focus. Let's call them the pacemakers, because they will set the pace of healthcare innovation. What if instead of the usual suspects, typically older white men like CEOs, doctors, lawyers, healthcare providers, opened up the pacemakers to more? What if they were contributors to the team that had absolutely no ties to healthcare? Imagine this. Teachers who would use their transferable skills to create easy, patient-friendly education, as well as educate those in your organization how to learn more efficiently and effectively. Airline pilots who are known to work well under pressure, who know how to use technology, as well as anticipate the inevitable and get people where they need to be safely. Wholesale business owners who could work to provide cheaper ways to access care. Community leaders who know what's going on in the various zip codes. They can help identify food deserts in order for us to send patient-friendly, disease-specific foods to patients using drones. Patients, like Mr. Jack, who can tell us exactly what they need in order to live healthier lives. Like the Imagineers, if we can dream it, we can create it. Adopting ideas from other professions is not something that we need to imagine. Healthcare has benefited from translating ideologies from other professions in the past. Have you ever heard of someone going to the hospital for a right leg amputation and erroneously leaving with their left leg amputated and telling both to go? Totally not cool. So of course, healthcare leaders were looking at other industries in order to avoid three buckets. 1, wrong patient. 2, wrong procedure. And 3, wrong site. They studied the airline industry's timeout techniques, and the Joint Commission was able to adopt the universal protocol, where surgeons are 1, required to identify the patient and procedure, 2, mark that site, and 3, time out to discuss with their team if there are any questions, as well as reconfirm those things to avoid the 3 W's while using checklists. This has saved countless lives. Imagine what outcome a group like the pacemakers could create if they come together to mesh their transferable skills in order to disrupt healthcare, disrupt costs, disrupt access, disrupt outcomes. What if a group could come together to not only transform healthcare, but to create a whole new world? A place where patients like Mr. Jack would not fall through the cracks, where we would not need an insurance company to approve an order where your doctor already determined that you need it, where people on the pacemaker board, like the community leaders, instead of food stamps, could provide digital health stamps, where people could receive cheaper exercise equipment, cheaper med, and healthier foods. Where patients like Mr. Jack, without traditional health insurance, could receive the same care as those with it. We need teams to come together to change the system. We can create that dream team, just like I wanted to create all those years ago when I was lamenting over those group projects. This is the greatest group project that can affect us all. We need people like you sitting at the table to help healthcare organizations create well decisions. Imagine what impact that could have on you, someone you love, or even Mr. Jack. We need you to engage with healthcare organizations. Apply for that job on LinkedIn, even though you don't have the recommended credentials. Advocate for boards to hear your voice. Become the disruption. And for those in healthcare leadership, I have 3 pieces of advice for you. 1, recruit widely. 2, have a bill box method of submitting ideas, Disney style. And 3, have a method in place for translating ideas between different groups in the organization. For example, doctors don't problem solve like engineers. So there needs to be a mechanism in place to problem solve in a team-based approach that won't have your team members dreading a group project like I once did. Everything we need to solve the healthcare dystopia can be found in creating diverse, intricately structured teams. Telemedicine is pushing the envelope with increasing access to care. Now, it's time for us to create a collaborative space across professions and cultures to save healthcare. Not only in your backyard, but the world. Or perhaps the metaverse. If you can see yourself joining healthcare despite your background, meaning you want to join the pacemaker board, raise your hand. Let's go save the world.